but you see Vijay's slides, a lot of material, well placed all over. You don't look crowded, but there are a lot of information. That's what Kimu said. I have to research each slide. I have to take my time, research the slide and get the extract.
Manithanam is looking for you, I believe. Manithanam is looking for you. Was that?
So, RK, no, I was going to say that one of my suggestions to Vidya for another episode is to get somebody to talk to particularly young residents and, upcoming faculty members on how best to make slides. There's a whole group that teaches people on what to put on slides and what not to put on slides and how the recommendation now is that whatever you want to say, you put it into the notes section of the slide and then choose a few touch points that will go on the slide. So, things like that. So there are many suggestions like that I think will make life easier for the younger folks now that there is some sort of, unified message that can be given to people on what's the best way of making slides.
Not only that, Ravi, we now have animation, 3D animation, etc. in slides. And that is something worth considering with the,
We have a lot of tricks up our sleeve to keep people awake during conferences. Fortunately, here everyone's completely voluntary, so we are good.
Ravi, you can come with suggestions as to if you have somebody in mind. That's always welcome.
Yeah, I'll definitely let you know. Yeah.
Or you can catch somebody from NTTC, Jipmer.
That's true.
Recording in progress.
NTTC Jipmer.
Yeah, I'll look into that. Actually, our live audience is not usually the young people who we originally thought we were addressing. So,
right. That is true. So we actually have a whole department that reviews our slides before they are released for outside consumption. Internally, it's fine, but anything that goes out typically has to be run by them, and they make quite a few changes. And initially I was very irritated with them, but now I think they do make a difference in how the slides look. So.
Okay, it's 8 o'clock and welcome to yet another episode of Marvelous Medicine. Dr. Vijay will be speaking to us for the third time, and today it's on secondary scientific health interventions and stress reduction. To moderate the session, we have Dr. Meenal Chauhan. She's a freelance anesthesiologist at Roorkee, Uttarakhand. Her MBBS from Kasturba Medical College, Manipal, and her DNB anesthesia from Dinanath Mangeshkar Hospital, Pune. She's a proud army wife, moving from city to city and adapting successfully in both her personal and professional life. She has presented several papers in many conferences and has received the General Proficiency Award from the Indian Society of Anesthesiologists in 2019. During the pandemic, she has done mind programming and psychological first aid courses and has been helping family, friends, and colleagues to cope with during stressful times. She recently started a public awareness page on Facebook, and we have weekly talks aimed at the public. At the moment, it's being done in Hindi, but in future, we'll be doing in other languages as well. She's a cheerful, vivacious person and the life and soul of parties and a wonderful singer. Maybe if we have some time in the end, we'll request Meenal to sing a song for us. Joining us as a special guest is Ramya Satish. She's a consultant psychologist at Synapse Pain and Spine Clinic and for the Shankara Educational Institutions. She's also a visiting consultant at Hamsa Rehab Center. Her educational qualifications are a bachelor's in technology, master's in social work and psychology, diplomas in transactional analysis, behavior therapy, and therapeutic yoga. Her focus areas are pain and stress management, personal relationships, social anxiety management, depression and compulsions, and she incorporates yoga in her therapy plan. She's involved in several social products and volunteers her time for several causes. Welcome, Meenal and Ramya. Dr. Vijay Bose does not need any introduction, so I thought I will just ask him a few questions. Dr. Bose, what made you change tracks, as it were, from operative orthopedics to health and fitness?
No, I have not given up orthopedics at all. No, I think, as I've been stressing in many of the talks, earlier talks, that it's very important for all of us. And we as doctors are very bad at lifestyle interventions. We're very good at disease interventions in our own specialties. We're extremely good at that. But when it comes to lifestyle intervention, we are not taught in medical school. If you look at, for example, somebody with who needs a lifestyle intervention, orthopedics, somebody says, how to look up to your knee. I mean, I'm not qualified. At least I was not qualified to give that answer because you are not taught in medical school and any of the courses that I have done. So this is something that has come up of late, which I thought was very, very interesting. And as important as disease intervention is to, for health intervention, to be healthy, not get disease. So prevention is the best, better than cure. So that's what kindled my interest, and that's what I have tried to pass it on to others. So that's it, Dr. Vijay.
Was it something you were always interested in, or and didn't have time to do, or something that some interest that you developed recently?
No, I always love observing patients. Various things, not just the treatment part of it and all that. So it's very fascinating that that we as specialists, for example, if we take orthopedic surgery, there are a lot of orthopedic surgeons who are obese, who have knee osteoarthritis. A lot of patients who are 70 years old without knee osteoarthritis. This is lifestyle disease. So who is the expert here? Is it the orthopedic surgeon or the patient? Yeah. So I knew that we need to have a sort of a reorientation of what we think in allopathy, as dictum and disease intervention doesn't apply to lifestyle at all. And whenever I see a patient who is doing well, who doesn't have arthritis, he's 75 years old, I ask him what does he eat. And if I find that in surgery I find the bones to be very strong, post-op I ask the patient what does he eat, what exercise does he do, because he's an expert. He's shown that bones can be fine at 70. I'm not the expert. He is the expert because he's proved it. So like that, if we reorient our thinking, we can really learn a lot about lifestyle. That's what kindled my interest. And I've been doing it passionately ever since.
Do any formal courses to gain knowledge and expertise on lifestyle management?
No, I have not, but I attend, all these webinars and stuff on various specialists who do this stuff. But I interact with a lot of other specialists like this, minded. But most important is that there is a like-minded group of community of doctors, predominantly from Hyderabad, who actually started this whole program that allopathic doctors must spend more time on health intervention apart from disease intervention. And this really gained momentum, and we're a large group now, and we try to spread the message that allopathy must change its orientation. We must not, view health intervention through disease intervention. It's something different, and is viewed that way. And this is now really picked the momentum now.
So, welcome, Dr. Rajaram, and thank you, Dr. Vijay, for taking those, extempore questions. And over to you to start your presentation.
Thanks, Dr. Vidya. First, I must thank Dr. Vidya and Dr. Pata for giving me this platform. The first two talks has had a very, very, very wide reach. I've had the calls from all over the world, actually, asking me questions, doubts, things like that, and how people have helped. What has been really heartwarming is that many people wrote to me that their lives have totally changed after they followed what they in the first two talks. And the good thing is a gap, and I hope some of them would give some experience how they've changed. I mean, we can keep on talking a lot of theory as we do, but really how it has changed lives. And a lot of people wrote to me about that, and it's been truly, truly heartwarming. So thanks, Dr. Vidya and Dr. Pata. And with that, I will start my talk. Right. Can you see my slides, Dr. Vidya?
Yes, can you go on slideshow, sir?
Yes, that's slideshow. Yeah. Okay. Right. So if you can't hear me or don't see slides, please do let me know, please. Yeah. Okay. Right. So this talk is part 3, which is on secondary interventions. There's optimizing sleep, improving breathing, and stress reduction. So we'll concentrate on all these 3 today. So Dr. Vidya wanted me to give a bit of a brief on the earlier 2 talks, so that people who have just joined for this talk and have not heard the previous 2 talks can also get a gist of what we are trying to talk about. So the first thing is we stressed earlier on that this master health check is not a good thing to know how healthy you are. It just helps you to pick up diseases. Disease intervention is fine, 20% of the population need it. But if you just get normal values in a master health check, it doesn't mean that you have optimal health. It's a pseudo wellness. normal values, just pseudo wellness. And actually, not only pseudo wellness, you are in a pre-disease state. And if you are not doing something actively, you are down in the slippery slope, and you are towards lifestyle diseases, lifelong status of taking tablets and medicines. So unless you do something actively, all of us are the slippery slope. And this so-called normal values, textbook normal values, actually is pseudo wellness. That's only pre-disease, and you're waiting to develop some kind of lifestyle disease or the other. So we stress that we must have some scientific, comprehensive way, not just doing something abstract, fragmented way, but a scientific, comprehensive way where we can address lifestyle diseases and how we can do lifestyle interventions. And then we talked about the first two talks of primary, how we get about doing that. And that's very important. So just to give a brief of what we did in the previous two talks. So the primary interventions are diet. We have to have a 3 macro diet. You must have good calories, not eat bad calories, etc. And this must be scientific, not just saying you feel good. Suppose if somebody has a disease and he says he gives some disease intervention, and you want objective parameters that you have really intervened in the disease. So like that, even for health intervention as allopathy practitioners, we need to have very objective landmarks. So these are the 5 metabolic parameters and key fitness indices, 10 of them, which we enumerated last time. But just for the people who are joined for the first time, I will go through it again. The fasting blood glucose, the HbA1c, and the fasting insulin, very important. Your HSCRP for inflammation, your lipid profile, which is only your atherogenic lipid triad, not LDL. We don't want to measure LDL. We want only ApoB, and we want to measure TGL and VLDL. And want to do liver function test for your ultrasound abdomen for a fatty liver. Blood pressure, very important. You want to know the BMI. Waist circumference is absolutely critical. VO2 max, we talked about. Resting the plank time. You want what is your 10 rep max. Everybody, we talked about balance scores, flexibility scores. We haven't talked about sleep scores, Bose score, and stress score, which we'll talk about in this. So this is a very scientific and very objective way of finding out whether you're healthy. Not just do a master health check, but making sure that you do, with all these parameters, that you're doing right interventions so that you go into the correct end of the so-called normal values. So we talked about how we can dial the diet based on how the 3 macros you can alter. And we talked about how you can dial your fasting, the daily fasting, as well as very rarely we do autophagy fasting, whether you plan a 2-meal program or a 3-meal program or whatever. And then we talked about the 4-dimensional exercise program, scientific exercise program, where you have flexibility and mobility as one dimension, muscle strength and bulk as another one, stamina and endurance as another one, and burning fat and calories as another one. So these 3 primary interventions are absolutely crucial. Today we talk about the secondary intervention, sleep, breathing, and stress reduction. So 3 primary, 3 secondary, and there are also 3 tertiary, sunlight, brain workout, and sleep. This sort of encompasses all that you need for any health intervention. Now, I'm sure a lot of people who are listening today have this question, and why is this guy who's an orthopedic surgeon talking on these topics? Should it be better if a sleep medicine? Now that we have sleep medicine specialists, we have pulmonologists, we have psychiatrists. Shouldn't a pulmonologist be talking about breathing? And should a psychiatrist be talking about stress reduction? So again, I think we're confusing with disease intervention and scientific health intervention. Both are quite distinct from each other. So today I will not be covering anything like sleep apnea syndrome or COPD or depression, etc. They are all organic diseases, and I have nothing to do with them. The specialists will take care of them, and that's sacrosanct, and I will not be going into that. However, health intervention is quite different. And it's very sad that the more we specialize, the less efficient we become in health intervention. The more specialized you are, the less, because health, as you say, is a holistic concept, whereas disease intervention is focal. So we like to, again, I covered this in the last talk, is health intervention holistic or compartmentalized? Now here you have a liver and you probably have gallbladder disease, and Pata, with all his, endoscopy skills can do a nice cholecystectomy. So a disease intervention can be focal, no question about that. Disease intervention needs to be focal. However, health intervention has to be holistic. If Pata says you eat some tablet like a cod liver oil tablet and your gallbladder and the liver will be fine, there's nothing more ridiculous than that. That's what we've been doing. We have been sort of, interpreting health intervention as a part of disease intervention. That's completely wrong. So we must not divide the physical body into subspecialty ones as we do in allopathy. So I told in the last talk, calling is gut health, women wellness, bone and joint health, immune boosting, heart fitness, absolutely ridiculous. And when we had this COVID epidemic, pandemic, people started eating kilos and kilos of vitamin C for boosting their immune system. There's nothing more ridiculous than that. What is the role of vitamin C in the immune system? If you have a lack of vitamin C, you will have a serious problem with your immune system. But if you have adequate vitamin C, even if you eat kilos and kilos of vitamin C, your immunity will not go up even by 1%. So let us all understand that. So how to improve your immune system? Simple. 3 primary interventions, 3 secondary interventions, 3 tertiary interventions. That's how you improve it. How to improve your heart fitness? 3 primary interventions, 3 secondary interventions, the same old story again and again. So the health intervention is holistic. So health and wellness is holistic, and all organ systems are intrinsically related and interdependent. Principles of improvement and lifestyle is common to all. So it's futile to think that you can do a focal intervention and improve either only your joints or your liver or your heart by doing a focal intervention health-wise. It's not possible. Either you are healthy or unhealthy. You cannot have a very healthy liver and a very unhealthy body. It just doesn't work that way. So we have made a circus of health intervention because we are specializing more and more. This is a recent meme that came in WhatsApp. Doctor, do you have any disease? The patient says, no. You take any medications? Yes, I take metformin, atenolol, aspirin, and rosuvastatin. Isn't it a very common scenario now? So we have really made a circus of health intervention because we are specializing more and more. I think we have to have a sort of a reset and start thinking completely differently. So we come to the topic for the day. The first thing that we're going to cover is sleep or the lack of it. Now we all know that we also lose sleep, say that sleep well, be well, etc. We all know that there are, if you're deprived of sleep, you will have a lot of minor issues like excessive sleepiness, yawning, irritability, fatigue, mood. That all we know. But what probably most of us don't know is that it can cause serious illness, absolutely serious illness. You can have cardiovascular disease, you can have poor immune system, you can have neurodegenerative conditions, risk of diabetes. So the same old monster that we covered in the first 2 talks, lifestyle diseases, whether it is diabetes, heart disease, coronary artery disease, joint pains, depression, non-alcoholic liver disease, the same old culprits come on again. So if you don't sleep well, you are asking for all these lifestyle issues. It's all one matrix. So remember that all 3 primary interventions play a big role in optimizing sleep. So we talked about the 3 primary interventions. Diet. If you do clean eating and don't sort of abuse your body by eating bad calories, then you feel light, easier to sleep and wake up. Very important. Diet is very important in getting good sleep. If you have a heavy, oily meal at 9 o'clock in the night, you're not going to sleep well. Now, fasting is very important. So you must have a significant period before you go to bed, 3-4 hours. Fasting helps in correct hormonal balance for sleep and going to bed without a full stomach. Very important. And I'm sure you all heard of that. The most effective sleeping pill is not that comes as a small pill, but it's exercise. Exercise is the most effective sleeping pill that I think we all know. A healthy body gets healthy sleep. So sleep, this also is very popularly sort of comes in videos and stuff. Simplified health mantra. It's not a very, very simplified for dummies. The health mantra, it is you fast 12 plus hours, you eat clean, you work out hard, you sleep deep, you repeat. You just keep doing this again and again, you probably will be healthy. It's a very simplified version for dummies. So this is about sleep. We should know. We all learned about sleep during our physiology days, and then we forgot about it. We learned again when we learned physiology for an entrance exam, PG entrance, and again we forgot about it. But it's very important to know the important components of sleep. So we have the 3 non-rapid eye movement sleep. Is the first stage is drowsy or awake. Second stage is light NREM sleep, and third is deep NREM sleep. And then apart from NRM, you have REM or rapid eye movement, which is stage 4 sleep. So very simple basics, and everyone, even if you're not doctors, you should know about all this. But the most important stage of sleep is the stage 3 or the deep non-REM sleep. Here is where the body revitalizes itself. You get energy restoration, you get cell regeneration, you get hormonal replenishment, you are promoting growth and repair of tissues and bones, and the immune system gets optimized. So if you sleep well, your immune system will get better. If you keep on eating a kilo of vitamin C, your immune system will not get better. So this is otherwise called a slow wave sleep or delta sleep. So this is the most important part of sleep, or the stage 3 sleep. Now I'm sure if many of you must have heard this. When you do abs, when you want to make a 6 packs, we said, six packs are made in the gym initially. Then we said actually six packs are not made in the gym. They're actually made in the kitchen and not in the gym. Now we know actually six packs are made while you're asleep. It's not made in the gym. It's not made in the kitchen. It's made when you're asleep. So no athlete can build muscle if he doesn't have good sleep. It's so integral. But we trivialize it. REM sleep is also important. REM sleep is a little more complex. It's not about if the body doesn't rest during REM sleep. Some brain activity goes on, the respiration increases, heart rate actually increases, vivid dreams may occur, and then you find that the body becomes immobile because you don't want to act out your dreams. So it has got a lot of psychological implications, REM sleep, and that's very important to have REM sleep as well. Temperature regulation occurs. The most important point is one should not wake up while during the stage 3 NREM sleep or REM sleep. So stage 3 deep sleep or REM sleep, one should not wake up. That's a very fundamental point which we miss. So we go through these cycles 3 or 4 times a night. So each cycle lasts about 80 to 110 minutes, and we go through 3-4 cycles every. Now it's very easy to know how to keep this, how much sleep that we need. Light sleep must be less than 50%. REM sleep must be 10 to 30%. Should not be more also. REM sleep must be more than 30%. So very simple values. Light sleep less than 50%, REM sleep 10 to 30%, and deep sleep must have minimum 20%, but more the minimal sleep is better. So nothing like, it's too much of deep sleep. So nothing like that. So minimum 20%, more the better. So these are simple values that everyone should keep in mind. So this is the circadian rhythm that we all learned again in physiology, that our body goes through various rhythms based on the day and night. And we've got to respect that. Now remember that you see the melatonin secretion starts at about 9 p.m. and then it stops at about 7 a.m. So I know a lot of people, youngsters will say, we go to bed at 2 o'clock in the night and then we wake up only at 9 o'clock. So I got my 7 hours of sleep. That's completely illogical. It doesn't work because you're not respecting the circadian rhythm. So that, there's altering sleep like that, absolutely a sort of a passport to disease, lifestyle diseases. No question about that. So between 10 p.m. and 2 a.m., we produce the greatest amount of melatonin. Melatonin influences human growth hormone secretion, and growth hormones utilize the body to burn fat, repair collagen, regenerate body. I told you about the muscle. You will build muscle from 10 o'clock to 2 o'clock in the night. And if you don't sleep from 10 o'clock to 2 o'clock in the night, you probably will not be putting on muscle. And you enhance immunity. That's when your immunity gets built, repair cells, etc. Absolutely vital. So sleep is just as important as food and exercise for creating vibrant health. So we talk always about food, we talk about exercise, but we never talk about sleep. As important, equally important too. Now, people with insomnia are 10 times as likely to have clinical depression and 17 times as likely to have clinical anxiety. So please do not ignore sleep. So make sleep a priority before you lose sleep over health. So a lot of people lose sleep over health. Before you lose that, try making sleep a priority. Absolutely vital, and you must pass on this message. So the next question is, how much of sleep do you need? Now, most people, would see these charts like this, and they'll say 7 hours, and the minimum of 7 hours is required, and that's what they will. That's what they'll usually say. Now, this is not a great thing to adhere to. It's like calorie counting, which we said in the first talk, that it's very bad. Calorie counting will never work in the long time. So sort of sticking to 7 hours is just not going to work. So what do we do now? So it's typically the biggest mistake or the most common mistake that people do is they'll keep an alarm clock. Suppose you're going to bed at say 11 o'clock, then they keep an alarm at 6 o'clock so that they get minimum 7 hours of sleep. This is bad habit, but this is the most commonest habit that everyone practices. This is a very, very bad habit. Why is that? Because using an alarm to wake up is really wrong. So many times, we see our colleagues or ourselves in the hospital, in the surgeon's room. I'm sure Pata would be there. People will be just sitting there physically, but they won't be there mentally. That's sleep inertia. There's confusion, fatigue, grogginess, poor mental and physical performance, although they had adequate hours of sleep. Why this occurs? Because they probably woke up during a deep stage 3 sleep or REM stage, because alarm went off at that stage and they woke up. That's the reason why many of us feel the sleep inertia, although we have slept adequate hours. And of course, if you didn't get enough sleep, you'll have sleep inertia. So keeping an alarm to wake up is bad news. You may wake up during stage 3 or REM sleep. So it's crucial that you wake up when your body is replenished, when you have adequate sleep for that person. So that the amount of sleep required for each person is quite different, and you have to wake up spontaneously. That's the only way to do it. And so nowadays we have, it's available on Amazon as well. If you want to have an alarm clock, you must not have a sound alarm, but you can have a light alarm. It emits a light. And then you don't wake up immediately. You get a breather of 10-15 minutes where you pass on from the stage 3 to REM, and you come to light sleep before you wake up. It's very important that you wake up only during light sleep. So when do you use an alarm? You use an alarm to time to go to bed, because we never set an alarm for that, but we know that the 3 variables are involved. One is the amount of sleep, variable from person to person. Somebody, you may have 7 hours, I may have 8 hours, somebody else may have 6 hours. Some people can even have 5 hours. Perfectly fine. It's so variable. The variable duration of sleep and the time one needs to go to the hospital at 7 o'clock in the morning, you need to wake up. So you calculate in reverse, and then you keep an alarm to go to bed, because that's under your control. But if you wake up during stage 3 or REM sleep, bad news. So you've got to use alarm for going to bed and not to wake up. So sleep hygiene, refers to avoiding mistakes that damage sleep. So the most important mistake, common mistake that we all do is we take our electronic screens to bed. Whether you watch television, whether you have an iPad or watch our mobile phones, this suppresses the production of melatonin. So, even before you went to sleep, you already damaged your sleep because you're looking at these electronic screens just before you went to sleep. Bad news. That's very poor sleep hygiene. Now, pillow position, your thoracic spine is there. Your cervical spine must be in the same level as your thoracic spine. It mustn't be above, below. And if that damages sleep. And you avoid uncomfortable room temperature, very cold or very hot, uncomfortable bed, blanket. These are all very important sleep hygiene. Rooms that appear the same, whether they are the day or night of whether it's the day or the night, that's a big, big, big health hazard. And I've seen a lot of rooms like that, many houses. There's very fashionable house. They have spent a lot of money, but it looks exactly the same day or night. It's a big, big health hazard. And the people living in that house very likely to develop some kind of lifestyle issues. So at your morning, your house must look like this, full of sunlight, and of course, night, of course, it's different. So how do we improve sleep? So sleep is a function of the brain. So senses are key to our brain. So we have smell, vision, touch, sound, etc. So to get to the brain, we use a sense, very simple as that. So subjective techniques can be used to fall asleep or increase duration of sleep, or increase the percentage of your stage 3 deep sleep, or optimizing your REM sleep. So we have a lot of things that we can do based on various senses that we have, and you can really aid. If you have a sleeping problem, the thing not to do is to take a tranquilizer, take a trica. That's what we all do as allopathics. That's exactly what you should not do. And what you should do is utilize these techniques that we have now for health intervention, so they can get good sleep. So the first thing is, you can have gentle stretching or yoga routines. These are not for the improve your flexibility. They're very gentle routines that make you sleepy. It's well described. You can have in your apps, in your mobile phone, sleep sounds. White noise or sounds which have the same amplitude or intensity throughout the entire audible range, 20,000 hertz. These are the white sounds, sleep sounds, rain falling, waterfall, etc. You now have, and these sounds will help you sleep. That's you're using your ear as a route to your brain to make you sleep. Now, image distraction is a very, very powerful technique. This is the science behind the bedtime stories our parents told us and what we told our kids, bedtime stories. The principle is that to transport the person to somewhere else. So typically a bedtime story or what you think about must not be your work or home, because it's something distant. Maybe space, maybe forest, maybe something very in a place filled of snow, etc. But far from your the day-to-day situations. And then immediately you fall asleep. So you can do it in 3 ways. You can either read a book like that, quite far away, or you can listen. There are a lot of, these are on sleep casts. You can listen to them, it transports you to somewhere else, or you can just imagine that you're going, somewhere in space, etc. So these are very powerful techniques that induce sleep. The other powerful technique is using acupressure. So you may have seen a lot of books and videos on this. But they're basically, if you compare the Chinese, very popular Chinese, and the Indian acupuncture, very popular. If you compare both, There are basically 5 points that are common to both. It's given here. You can take a screenshot of this. This is exactly the points common to both, and they work extremely well. You can see the points, 3 fingerprints above the palm or crease. You can see the wind pool. Different Chinese and Indian names are there, but the same points just below your head on the back, and your first web space, the foot, and then you have 3 fingerprints above your medial malleus and the ulnar border of the hand. These are the 5 basic points, and what you need to do is to massage them for 2 to 3 minutes with your thumb. Once you do that, you find that you can go to sleep quite effectively. Very, very effective techniques apart from using tranquilizers. Now, what about drinks? Initially, people used to say drink a glass of milk or boil a banana and drink, but these are not good because they interfere with your fasting. So we don't recommend this now. The only thing that available is tea. Any type of tea that we have, which is non-caffeine, it's not have caffeine in it, and a lot of teas can make you fall asleep. So it makes it a routine, have a tea, and you fall asleep. Then there are other techniques to induce sleep would be breathing techniques, which we'll cover in the other topic on breathing. And then there's something known as progressive muscle relaxation techniques. You start from your head to toe or toe to head, you relax each part of your body, and as you keep relaxing them, you go to sleep. They're all very, very effective techniques. And these two are techniques to improve quality of sleep, so that your deep sleep is better, not to fall asleep. Here you have deep sleep guided meditation. Again, you have apps for that, and they will guide you. And once you listen to them, your deep sleep can get better. Again, same guided programs for hypnosis for sleep. Hypnosis, as we know, is a very effective tool for most people, but about a quarter of the people will not respond to hypnosis. If you respond, it's great. If you find that your deep sleep is lacking, it's a good way to go about it. Monitoring of sleep today is excellent. You have all these fitness devices, and they'll give you a snapshot of how you have slept. I find it to be extremely accurate. How much of light sleep you had, deep sleep you had, REM sleep you had, and your sleep score. Was it good? Is it getting better with all these interventions or not? Is it getting worse or is stressed out? Everything is beautifully monitored, and strongly suggest that you get a device like that monitor your sleep. So effective these days. So most companies are quite uniform in how they now present itself, and I think it's a great tool. Just like a pulse oximeter was so useful in the COVID pandemic, I think these devices are now extremely useful. However, people who don't have this device, you can use your cell phone itself, and there's an app called a Sleep Scope. This you can just keep it near your bed, and it uses sonar, just like a bat. And it's quite surprising that it actually picks up it quite well. You can find out what is your deep sleep, REM sleep, etc., just by keeping it near your bedside. Just your app, the phone. There's no need for a fitness device. This also works very well. This app is called a Sleep Scope. We go to part 2 now, which is improving breathing. So whatever types of breathing that you have, whether it's Taoist breathing, whether it's our Indian yogic breathing, or whether it's Chinese Qigong or sea breathing, whatever it is, the common principle is that correct breathing is diaphragmatic or belly breathing. I'm quite shocked that many doctors simply don't know that. Whenever we say deep breathing, we immediately puff up our chest. That's what is our, when we auscultate, we ask the patient to puff their chest up. That is wrong breathing. That is chest breathing. But most doctors think that is deep breathing. Really surprising that most doctors don't know the correct breathing is diaphragmatic. So whichever system of breathing that you go into, it's a common principle. Correct breathing is diaphragmatic or belly breathing. There's no doubt about that. So, and then what else we can do in breathing is there are specific breathing techniques that can help you in various ways. So we'll cover a bit of that. So the correct breathing technique is diaphragmatic or belly breathing. So when you inhale, your belly must come out, not your chest. The belly must come out. And as you know, babies and children have abdominal breathing like this. But as we grow older, probably because we don't want others to see our tummies, we sort of stop doing this type of correct breathing. And we have short chest breathing, which is very bad for health. And the correct breathing is diaphragmatic breathing or belly breathing. Now, when you do chest breathing, it's very shallow breathing. You get prone for infections and all your lifestyle, again, diseases. Your diabetes, your heart disease, your joint problems, all these come when you don't do correct breathing. Now, look at this. When we do chest breathing, the volume of air you inspire is so little, but you do correct abdominal breathing, many times more of air you can inhale. So we must all start learning to breathe diaphragmatic for a healthy lifestyle. Now, whatever type you take, you see yogic breath, inhale to the nose, and your stomach pushes out during inhalation. And during exhalation, your stomach goes in. But most people, especially allopathic doctors, would actually do the reverse. So chest breathing is shallow breathing and inherently flawed. So deep breathing benefits, again, all these lifestyle issues, heart disease, liver disease, mental issues, everything, same old monster again. You don't want all the lifestyle diseases, you've got to breathe properly. Breathe properly, you've got to breathe properly as well. And the Stoics' famous statement, it says, to breathe fully is to live fully, to manifest the full range of power of our inborn potential for vitality in everything that we sense, feel, think, and do. So breathing is as important as, correct breathing is as important as sleeping. The common mistake to think is that correct breathing should be done only when you do some asanas or when you're doing meditation. That's completely wrong. Breathing must be done all the time. So when you're in a car, for example, somebody else is driving, when you're watching a movie, when you're reading a book, when you're listening to something, when you're sitting in a class, listening to somebody talk, it's a good time for you to practice good abdominal breathing. Absolutely. So throughout the day, you keep practicing abdominal breathing. So again, just like sleep, we have various techniques by which we can improve our breathing, and they have specific purposes. So you can work with ratios, you can have breath awareness, you can have pattern breathing, you can have vocal breathing, you can have breathing for cleansing, or you can have wall breathing. Briefly, the first thing is mindful breathing. Mindful abdominal breathing is the simplest form of meditation. So we all, just be aware of the breath going in and coming out without being a big in yogic science and all that. Just simple common sense. Just be aware of your breathing, and it's got tremendous benefits. This is a very famous statement. Feelings come and go like clouds in a windy sky. Conscious breathing is my anchor. So, whenever possible, be aware of your breath. Simple common sense, and it will give you tremendous health benefits. And next is working with ratios. Now we have 4 phases of breathing. You can inhale, hold, exhale, hold. So you have 4: inhale, hold, exhale, and hold. Now, how is the proportion going to be? Will give you different benefits. So if suppose we have inhalation is less 4 and exhalation is 8, whether it's seconds or counts, then you find you get a very relaxing effect. In other words, you find that you have 1:2 ratio, inhalation 1 to exhalation 2, you have a very relaxing. So we talked about sleep. So if we do this kind of a breathing where you do a 1:2 ratio, then you find got a very relaxing effect. But as you come down this chart and you have more equal inhalation and exhalation, then it's called as balanced breathing. More towards balancing. And if you push it more, it becomes energizing. So just by altering the inhalation time, hold time, exhalation time, and hold time, you're able to alter what effect that you want with breathing. So this 4-7-8 breathing is a very popular technique. Very extremely popular, very useful as well. So I think everyone should know about this 4-7-8 technique. And this is called as a natural tranquilizer, not taking Trica, but this is a natural tranquilizer, 4-7-8 breathing. Okay. So working with the ratios so the other type. So we talked about 1:2 ratio. Now the other one where both are equal is called as box breathing. Again, very popular technique used world over. But you breathe in for 4 seconds, you hold your breath for 4 seconds, you breathe out for 4 seconds, then hold your breath for 4 seconds. Very popular technique. And of course, in our Indian yogic thing called as samavritti or equal breathing. Again, the same technique. It's also called as Navy SEAL technique. So in high pressure situations in the army, Navy, etc., the army personnel are taught this technique of box breathing, where they do this technique and immediately they get calm. High pressure situation that you have during war, etc. They are all taught, Navy SEALs, etc., do this box breathing and immediately calm you down. It won't put you to sleep, it won't tranquilize you, but you'll have a calming effect. So simple breathing techniques, so important for a healthy lifestyle. Firstly, lip breathing is when you have short of breath for any reason. Suppose you go to a crowded place or a room without ventilation, and you find that you're short of breath. And then the simplest thing to do is on an aircraft, for example. But simple things would be to first lip breathing, where you take a simple inhalation and you purse your lips and you exhale to a count of 4. Inhale to a count of 2. And first lip breathing will, of course, open up your alveoli, and therefore it becomes a very efficient, keeps the airways open for longer and helps to open up the alveoli. So if you are, for any reason, if you are difficult in breathing, the thing to do would be a pursed lip breathing. Vocal breathing, a very popular technique is bumblebee breathing. Lot of effects, again, same anti lifestyle disease effects, calms the mind, nervous system, boosts immunity, reduces blood pressure. Absolutely. This, of course, we inhale, and when we exhale, we make the sound of a bee. Brahmari in Sanskrit refers to the bee or the wasp. Now, this Ramdev's Kapalbhati, you would have seen in videos and in television. He made it very popular. This is breath for cleansing. Suppose you go to a crowded place, go to a movie theater, go to a hospital. These days, in day of Corona, you want to go to a hospital and you come back, it's very important that you cleanse your respiratory system by doing something for cleansing. The most popular one is Kapalbhati, as shown here, but it's a very more violent way of breathing, where you exhale all your alveoli and all your whatever you inhale completely, and your abdomen goes. Exhalation means the abdomen goes in, abdominal breathing. So that's Kapalbhati breathing. Now, the other type of, the breathing for cleansing, so you is the Bhastrika breathing. That's the rapid, forceful breathing. Here you find that both inhalation and exhalation are both forceful. Whereas in Kapalbhati, only the expiration is forceful. Inspiration is natural. Whereas in Bhastrika, you find that both inspiration and expiration are both forceful. So these are breathing techniques that you use for cleaning. Whenever you go to a hospital, for example, it's a good thing to do when you come back. And these are, of course, known as kriyas or cleansing techniques. Pattern breathing. Pattern breathing is more for children and things like that, where they count their fingers, where they inhale and exhale, where they don't understand this inhalation, exhalation. You can ask them to do this, known as starfish breathing. Again, for adults also, for patients, you can, where you start becoming aware of your breath. Again, has got a lot of benefits. And apart from the starfish, you have a lot of other shapes that you can use for any type of pattern breathing. Now, again, there's now objective assessment of breathing. So this is known as the Bose score. This is not the maximum breath holding time. A lot of people think it is the amount of time that you hold your breath. No, that's not how you objectively assess your breathing capacity. How good is your breathing? This is a Bose test. Bose test means you take a small breath in. You don't take a deep breath in. Just take a small breath in. And then it goes by itself. You breathe out naturally. And then the time that you take till you see the first signs of air hunger, whether your axillary respiratory muscles start working or you're starved of breath, that is the time. It's not your maximum breath hold time. So just a natural time that you need before you get air hunger. That's your test. Very objective scores are now available. The Bose score, so whether from 0 to 9 would be very bad. High scores of 60, 70 would be great. And based on the time, it knows average. So basically, if you're over 25 or okay, but less than 25, you've got some serious problems. You need to do some serious exercises like yogic pranayama, something like that you have to do to improve your breathing. You go to the third topic of the day would be reducing stress. Actually, de-stressing is similar to falling asleep. So principles are the same. So you use your senses to relieve stress, either sound, smell. This is, we all know. You can listen to music. You can have some aromatherapy. You can have some natural tea. You can do Jinshin Jutsu. That I'm sure you all heard of that. Where your 5 fingers represents different things that you worry about: fear, anger, sadness, self-esteem, poor self-esteem, etc. And you massage these fingers, you'll get, this is a very popular Japanese technique that you have. You can manage to exercise, a great stress buster. We know that. You go for a jog. And of course, you can have sight. You can watch a cartoon, for example. They're all very well-known things of how you manage stress. But more importantly, the real thing is how to prevent stress. That's what I'll be concentrating on. So remember the 7 P's. You can take a screenshot of the 7 P's. It's peace with life yourself. You need to have some peer group activity. You need to practice a mindfulness. You must pinpoint the source of your stress, prayer and spirituality, prioritize the right things in life, and the purpose of life. These are these 7 P's in helping in preventing stress. So the first is peace with life and yourself. So this is the most important prayer that we have, the serenity prayer. Okay, now everyone should do this prayer every day. Everything I think. So the prayer is, of course, we all know this prayer. Where God grant me the serenity to accept things I cannot change, courage to change things I can, and the wisdom to know the difference. If it says prayer every day, I think half your stress will go away. Now, there are things that we cannot change. The only thing you can do is you can bang your head somewhere about that thing. You can't do anything about that. So wasting your energy, wasting your life force, etc. on that is absolutely ridiculous. However, we are not totally sort of detached. You must always focus on things that you can change. So this prayer is for two things: serenity to accept things that you cannot change, but really, really focus on things that you can change. So if you accept that, then you are in peace in life and yourself. Peer group activity is a must. Peer group refers to a group which have sort of equal mind. Your subordinates at work or your boss at work are not your peer group because you're not interacting them at the same level. So you must have somebody who's your peer group, and then only so you can have some activity like some cycling, jogging, sports, etc. You can have something together as poetry, music appreciation, whatever it is, or you can play some music instrument, whatever it is. But you must have some peer group activities, absolutely, because we are social animals. Without peer group activity, you will become a recluse, and that is a sure way of getting sick. All these three things are so important for overall well-being. So practice of meditation and mindfulness is the other important thing to prevent stress. Now, a lot of people confuse meditation with various other things. Meditation is not going to a very remote place and thinking of something esoteric, not at all. So meditation is a practice to achieve a meditated state. Just like how we sleep, the brain goes into sleep. We all know what sleep is. We all know how to get to sleep. Similarly, there is a meditated state. It is a physical state, just like sleep. And reaching a meditated state has numerous benefits, but it's not a biological function. It's got tremendous benefits. But unlike sleep, it's not a biological function. That's why we don't concentrate on that. In the meditated state, the body is relaxed, the mind is quiet, and the spirit is awakened. So 4 techniques are used for meditation. One is mindfulness, focus, chanting, or guided, and open awareness. These are the 4 techniques that are always used in meditation. So again, the same old thing. Meditation is lowers blood pressure, it prevents diabetes, it fights heart disease, relieves anxiety, improves your bones and joints, exactly improves fertility. Exactly the same. Again, the same old lifestyle disorders that we have now. So whichever part of meditation that you take, whether it's Chinese, Taoist, Buddhist, Hindu, yogic, is all the same thing. It's all the same thing. So don't confuse meditation with religion, etc. So types of meditation, as I told you, you can either concentrate on something, or you can be mindful of something, or you can call it open monitoring. You sort of detach yourself and see what's happening. So this is the very simple. So just like falling asleep, it is just a practice like any other activity. You practice these things, then you reach a meditated state. Once you reach a meditated state, it gives you tremendous benefits, especially fighting stress. The third piece, positivity. Positivity is being prepared for happiness. We all say we want to be happy, and that's the goal of life. But we're not positive. We're negative about most things. So just like if you are very, if you're very industrious, you will be very lucky. So the industriousness, you're being prepared for luck. Just like that, you find that positivity is being prepared for happiness. If you are not positive, it's very unlikely that you're going to be happy. So happiness is a mood, positivity is a mindset. So only if you're positive, you will get opportunities to be happy. If you're not positive, you're not going to be happy and you're going to be stressful. So we all know about the happiness chemicals. You have learned them. Dopamine, oxytocin, serotonin, and endorphins are all the happiness chemicals, which all secrete due to various things that we can see that. We all know about this. But unless you have a positive attitude, none of these hormones are going to secrete in you. So positivity is absolutely critical. And unless you have positivity, you cannot experience happiness. So to be prepared for happiness, you must be positive. Purpose of life. This, I think, ikigai, now very well known Japanese ikigai. People think ikigai is what you do in pastime. You do some kind of pastime that you do. That is ikigai. Ikigai is not that. Ikigai is something that the purpose of your being. We always refer to this term as God-given gift. Somebody has this God-given gift for surgery or whatever. So that guy's ikigai is surgery. So ikigai is something that you're intrinsically very good at. It's not a hobby. It's something that you're very good at and that you pursue. It may be a profession, may not be a profession. There's one of my batchmates from Madras, cardiothoracic surgeon, who is such a good writer. But only recently we know that he's such a good writer. Writing was his ikigai. Now he writes a lot, absolutely brilliant writing. That's ikigai. Although he's a cardiothoracic surgeon. So like that, we all have our ikigais. So unless we find whatever ikigai is. We're all talented at something, intrinsically talented, God-given talent. And we find that we may not, live to our full potential. So we must be look out of what our ikigai is. And once we do our ikigai, our mind and body is sort of is satisfied. Okay, so that's the ikigai. Finding your ikigai for the purpose of life is, but need not be a profession. It's not a hobby, but finding what activity that you are born to do. Could be photography, could be whatever it is, but you must be intrinsically good, not practice and good. You must be intrinsically good at it, and that's your. So if you don't find your ikigai, you cause stress. Prayer and spirituality. So we talked about mind and body. Ikigai is finding what is your mind and body needs. That's the ikigai. That's one more element to our existence. That's spirit. And ignoring the spirit is a common cause of stress. You don't account for spirit, you're going to cause stress. So all humans, whether you acknowledge it or not, they're all essentially spiritual beings, whether you acknowledge it or not. So spirituality is recognizing the following. You recognize there's something more in everyone than just the physical organs put together. So if somebody is Pata is not just his organs, but it's something more than that. That's his spirituality. So we can then also be, we can experience something more than just the sensory ones. Apart from hearing, smelling and touching, there is something that's a higher experience, and that is spirituality. And that we are part of a greater whole in this universe, whether it's called cosmos, whatever, God, whatever you want to call it, but we are part of a larger whole, and that is spirituality. And exercises for spirituality is called prayer. Prayer is not what you think it is. Exercise for spirituality. When you connect with your spirit, it is part of a bigger thing and not just isolated, then we call it prayer. So we are all essentially spiritual beings. Although some people will say that that they're not spiritual, there's nobody like that. You just not identified with spirituality. And if you don't identify with spirituality, you're always you're not restful. You're always a state of unrest until you find your spirituality. Because we are made of mind, body, and spirit. We know how to take care of the mind and body. We also should take care of the spirit. Spirituality is not religion. Religion is what practices or rituals should I follow, what is right and wrong, what's true and false. Spirituality is quite different. Where do I find meaning? How do I connect with the spirit? How do I feel connected to the larger being? How should I live? So spirituality, and don't confuse spirituality and religion. So then the next P is prioritizing to remove worry. Now, I find that the 4 top worries for Indians are the following. We all worry about our health. We worry about dependence. What if something happens to me? What do my dependents do? And we all worry about children's wedding, and we all worry about retirement. These are the common worries that colleagues that of mine and everybody have. Now, again, it's very important of serenity prayer, not the first part. And we cannot accept, we have to accept the things that we cannot change, but we must constantly do things that we can change. And all these 4 things we can change. Therefore, we must act on them. It's so critical. The first thing is we all are most worried about health, but we never do anything for health. And we now told you in 3 talks what to do for health intervention. So you must actually do it, and then you probably have taken care of health. Now, what about dependence? So how much of life insurance you should buy? I keep asking them to everybody I meet, my friends and colleagues. People, usually, have life insurance for the sake of it. A lot of people may not know, but the minimum life insurance that you must have must be 10 times your annual income. Suppose your income is 1 crore a year, you must be insured for 10 crores. So if you die, your family will get 10. That's minimum. You can have more than you want. Now, once you have that amount insured, you feel dying is not a bad thing, 10 crores is a lot of money. 10 times your annual income is a lot of money. So you feel not bad dying. The family also not, I suppose, don't feel bad when you're dying. So you can take care of it. You can take care of your worries. It's not difficult. Children's wedding, only in India and in Greece, we have this exorbitant wedding spending tens of crores. And we work for 30 years of productive life to spend on 2 days of wedding. I think these exorbitant weddings must be banned. We should not have these weddings because this has led to a lot of problems and worry, sickness, illness, and all that because we have such a big expenditure. I think we should have a very limited expenditure. We may tell our kids, this is the expenditure that I've saved for your wedding, limited, and that's what we'll have to use. I think the government must, especially post-COVID, I think the government must ban all these exorbitant weddings. Then we take care of an important worry for Indians. retirement. Now, regarding retirement, we want to keep on making money because we don't know what we're going to do in retirement. Once you put in, you tabulate what I'm going to do in retirement. I'm going to travel to these 10 places. I'm going to, probably play bridge. I'm going to probably do some gardening. And then once you tabulate that, you find the expense very limited. Why do you want 100 crores for that? Why? So once you tabulate what you want for retirement, it is very easy to provide for that. So all four of this, which seems to be the top worries for Indians, can actually be taken care of quite nicely. But instead of taking care of them, we keep worrying. And that's the reason why we develop the problem. So finally coming to quantifying stress. Now we have these excellent tools. That's the same watch that I have. It gives you an excellent, and one day, if I had a stressful surgery, some complication has occurred, thing like that, it'll show you so brilliantly that you are under stress. So please do not ignore these tools that we have. Very important tools. Please do not dismiss them as as toys. Technology is catching up. I mean, who would have thought that we in our lifetime will be driving battery operated cars? So all of us are going to drive battery operated cars in the next 5 years. Who would have thought? So these technologies caught up so well, and it picks up stress so beautifully. So don't ignore this technology. I'll give you stress, and you know that whatever you're doing is stressful, and you know whatever you're doing not stressful, and all these interventions that I talked about, that you do it, and how your stress gets addressed. So important for being healthy. So again, we go to our template. So we talked about the primary interventions in the first two talks. Now we talked about the secondary. How do you optimize sleep? Not in the duration, but the quality of sleep. How do you do improving breathing? And for specific benefits, you have to use various breathing techniques for specific benefits. Stress reduction is very important. Once you apply your mind to stress reduction, it's actually not that difficult to do stress reduction. And once you do this, you're always updated. These are not subjective parameters. You'll find that objective parameters improve. What is very interesting is that some people have told me they've done all these primary interventions, still, they have not had a positive impact on all these values. And then once they start doing second intervention, there's really a beautiful impact on that, very pronounced impact on that. So all these impact is good. Tertiary is also important, but there's very straightforward sunlight, brain workout, and clean air. And with that, you would be able to. So I thank you for your attention. Thanks again, Dr. Vijay and Pata.
Thank you for that wonderful talk, sir. Over to you, Meenal and Ramya.
Yes, sir. Can you hear me? All right.
Yes, we can hear you.
Yes.
Could you stop sharing your screen, sir?
Yeah, just a second. Yeah, got it. Yeah.
Firstly, I would like to congratulate you. I think the audience seems to be very happy. We have a lot of people saying excellent presentation, and I can't agree more with it because this, I think, is the need of the hour. I was recently reading about so many. I'll speak for my own specialty. So many anesthesiologists, who are actually committing suicides, and they are undergoing a lot of mental health issues. And it does become extremely important for us to focus on all these primary as well as secondary interventions, and of course the tertiary ones, which you also mentioned. Uh, so I have a few observations to make, sir. Firstly, I will talk about the sleep, the sleep you said. So there was University of Colorado, actually. They've done a small study where they put people without sleep, like they just decreased the number of hours to just about 5 days. 5 days was the only time. And in those 5 days, they realized by decreasing the hours of sleep from 8 to 4, people gained 1 kg of weight. So that, I think the audience should take away from this, that what sir was saying is so important because it is directly proportional to your mortality. Also, the ghrelin hormone, which is there in, which is called the growling hormone of the tummy, the stomach, that also starts increasing actually when you sleep less. And it asks you to get into this binge eating and little bit of eating here and there. So my question to you, sir, here is that there are many of us, we are young mothers or even some middle-aged people. We get up many times during the night. We have young kids to attend to, and maybe we slept just for 4 hours, and we get up and we to feed them, or maybe whatever. it's difficult to get back to sleep. So people, what they do is after those 4 hours, they don't sleep. They begin working on their laptops or on their phones, and then they think कि अभी तो नींद आ नहीं रही है. So would you like to give them a little bit of a dose on it's important to go back or something like that?
Well, obviously, it's not the ideal situation when you're forced to wake up at night time, when you have a baby and things like that. But of course, you at least compensate for the total duration of sleep. When you can sleep in the daytime, you should, so that you have at least the total, although, your deep sleep, your continuity of deep sleep, etc., will get affected. So all those things are there, but you must have this total, suppose for somebody that 7 hours of sleep is what they need, they must try and compensate as much as possible so that you are able to at least partially, not the best situation, but at least, but it's temporary pace in time. You'll of course get over it soon. So then I think, you need to compensate in the daytime for that. As you said, what you should not do is, look at your cell phones and be busy with WhatsApp during that period. Yeah. You must compensate for sleep loss as much as possible.
Also, do you suggest catching up sleep and naps in the afternoon? Is
Yes,
it good to sleep in the afternoon?
The afternoon nap is a controversial topic, but I think what is now known as a large amount of sleep during afternoon is not a good idea. The interface with the sleep at night, but a cat nap or a 10-15 minute sleep is supposed to energize you, and a lot of people do that, and I think that's perfectly fine. But sleeping for 2-3 hours in the afternoon is certainly not a good idea, and that's going to interfere with your deep sleep at night. Certainly, it's going to interfere with that.
Okay, sir. My next question, sir, comes. It's an audience question. Actually, I want to know. You spoke about all the breathing techniques, the abdominal breathing and the various pranayams which we do. So I would like to know how much time one should devote during the day to do these techniques. And I think we should just stress enough that it's not necessary to give half an hour. Even a little bit time would be sufficient, I think. So if you would want to say something.
So yeah, thanks. So that's what I said in my talk. So we're all busy in our day-to-day routines, and we don't have time, especially for sitting down and breathing for 20 minutes. So you have to combine it with daily activity. When you're doing surgery, when you're giving anesthesia and you're sitting down, that's when you do your breathing techniques. It's traveling in a car, reading something, watching a lecture, listening to a lecture. That's the time you do breathing. Breathing is not something that you go to a very quiet place and then you start breathing. Breathing is what abdominal breathing and the correct breathing and being aware of your breathing is what you do as a second nature. That's what babies do. That's what you must do all the time. So whenever I get time, I try and breathe correctly, even when I'm doing sports. And this type of breathing is so important in all sporting activities. A lot of coaches will tell you that's a very important thing. So when you're jogging, when you're walking, that's the time you breathe correctly. It's a second nature to you. It must be second nature to you. It's not something, busy lives, you don't have time to go and spend half an hour on breathing. That probably is okay theoretically, but it won't work in real life.
So there's a question which says that, we have an audience. He says that I'm 76 years of age and I get up 2 to 3 times at night, to attend the nature's call. So is it fine or, should he control it?
Well, it's not fine certainly because you're getting interrupted too much. You must find out what is your problem, prostate problem or etc. And then you must fix it. Really, that's the way to go. And maybe, once or twice, okay, but frequently, sun is going to interfere in sleep. And you're going to have sleep problems. No question about that. Yeah. What was your problem that making you wake up? We must fix it.
Right. Ramya, you have anything to add?
I think we should also keep in mind the age, right? And the significance of it in getting up in the middle of the night. So it is one thing for for a youngster to get up in the middle of the night, and there are other factors and elements that are involved in an older person getting up in the middle of the night.
Professor Rajaram, you wanted to ask Dr. Vijay something. Could you please unmute yourself, sir?
Yeah, Vijay, it was an excellent presentation, but I want to know how would you like us to translate the message that you have given so far to the members of the community? Because that is where is very important for us to convey.
Yes, that's a problem, and especially for patients. Somebody asks you, how can I avoid joint pains? Now, I cannot talk 3-hour lecture on this to the patient. That seems to be the problem. Neither can I give a one-word answer to him. It's a very tough thing, especially for our patients. But for the community, I've done this program so many forums, my club, so many for Rotary, everywhere I have done, and that has really passed on the message like a domino effect. So I think whatever we can do, your own relatives, your friends, circles, you have to pass the message. I think that's the way to do it.
Yeah, will you agree with me that all of us should contribute towards teaching and imparting education to the community?
Absolutely, absolutely, yeah.
Vidya, Amit Luthra has kept his hand raised for a long time. Please, sir.
Let me introduce Amit Luthra before he asks the question. Amit Luthra is a Arjuna awardee. He has been given the Arjuna award. He's currently in our hospital. I've done a hip surgery on him. He's been representing India in golf for 30 years. Currently, he also represents India. He is a recipient of the Arjuna award, and currently he's in Sims Hospital floor. Amit, yes, Amit.
Great.
You stolen the lines I was going to speak. So I was about 3 months back in Cleveland for my sister's open heart. And luckily I met Dr. Brooks, who spoke very highly of Dr. Bose and also Dr. Ashok Kumar. And till then I had met all the heavy hitters, orthopedic surgeons from Delhi, Medanta, Gangaram, etc. And nobody even told me about resurfacing. Only when Dr. Brooks recommended Dr. Bose's name, I did some study and I said, okay, that's the way to go. So anyways, coming back to it, I thought he was a good orthopedic, but I think after his talk today, I have to change my views. I think his views on, the serenity, the breathing, etc., is slightly better than his taking away from there. So, doctor, I would like to ask you one question. In this pandemic situation, the second wave has just gone, third is expected. Second was very bad because everybody has lost some near and dear ones. I mean, without exception. First was still okay. We were hearing people are losing, but they were in the periphery. But in the second wave, everybody has lost. And with the bombardment of the print media, electronic media, is not helping matters. Luckily now it's subsided a bit, but till about a month back, people were losing sleep. They didn't know what to do. They were overworked. It was like doomsday. So in that situation, how do you, it's easier said than done that you do pranayama and you do meditation and all. But practically, how do you actually do it? Because when push comes to shove and it happens to you, that's the time you realize that, yes, it's a very, very grave situation. So what is the cure? Not cure, but what is the way forward in that?
Yeah, coping with stress is a different, topic by itself. However, it's been my observation, and other doctors can pitch in, that the people, who developed a serious version of the COVID disease were people who were unfit or had lifestyle issues. It's again been published. So all these people, who were good in diet, exercise, fasting, sleeping, breathing, they didn't get a serious form of the disease. And that has been a very important observation. So that's probably why, because their immunity level was good or whatever. And then, the same answer to all lifestyle issues. How to avoid COVID, not vitamin C, but think of all these 3 primary, 3 secondary, and 3 tertiary things there. But coping with stress, that's a different topic, which, which is a talk by itself. Yeah. So I'm not able to address this now.
Galaxy M21 also is the hand raised for quite a while. Whoever that is, please. Galaxy M21. Can you unmute and ask a question? Yeah, but there's no response.
Okay, till such time, Ramya, would you like to take the previous question?
Yes, as Dr. Vijay mentioned, I think we need to have an overall picture, and we need to work through the stress management. We need to divide it into multiple parts and work through smaller goals to achieve a better management of the whole situation. If I may add, It has been an excellent presentation, Dr. Vijay, and you have covered a lot of things: ikigai, qigong, yoga, tai chi, mindfulness. A plethora of options that you have given us today. This is a very relevant topic to all of us, who is living in this pandemic era, going through uncertain times. So many of us are having sleep disturbances, and I would really like to highlight the plight of pain patients. Here in this space, and I think it is very relevant to the presentation that you made today, Doctor. So the connection, the relationship the pain patients have with sleep is very tumultuous. Again, I mean, no good sleep. They're not able to sleep well in the night because of the pain. They get up in the morning. There is no regeneration, no repair, no restoration. Again, the pain is pronounced in the morning. It is really tough on them. We in our Synapse Pain Clinic, we are a team of professionals. We are very focused towards the patient outcome, and we engage in multidisciplinary approach along with the pharmacological interventions. When we are using other techniques, when we encourage our patients to follow sleep hygiene, to have a nice environment, as you said, to dim the lights, multiple things that we do which are actually proving very effective. After the point in time, we'll be able to even come up with data as to how it is very effective, in their sleep cycle management. So if
would you like to add something on coping with stress, Mr. Amit Luthra's question? Want to unmute yourself, Meena?
Ravi Shankar, yeah.
Can I speak?
Yeah, go ahead.
Okay. Yeah. So basically, in the psychological first aid, they teach us about this whole thing about coping with stress, which is a very different presentation, as Sir said. But the first thing is to actually recognize those signs of stress which are beginning to happen in you. It can be cognitive, it can be psychological, it can be social, it can be withdrawal, hopelessness, helplessness. And then the second thing is actually to first to recognize and then you listen to people. Either you listen to yourself and ask for help, or there is somebody else who observes these changes in you and gives you that help. So it's also very important that we as individuals, when we are trying to help others in dealing with stress, we have to have that patience and that non-judgmental nature, I think. It's important to listen with empathy. That is very important. And there is a very mild difference between empathy and sympathy. See, empathy is when I put myself in somebody else's shoes. And sympathy becomes when I start attaching feelings to it. So it's important that we actually listen to them so that they feel they are uninterrupted without saying, this happened with me also. Then they feel there's a disconnect. And also give people time and let them understand that it's normal. Like, for example, you spoke about COVID, Mr. Alutra. So it's normal for people to get admission. There are people dying, you're getting affected, etc., etc. So tell them that this kind of dealing with stress is normal for about 14 days or 15 days, when we are going through that grief and all that is normal. And then comes the third part of linking people or yourself, if you realize that you are falling a trap, to certain social groups. It starts with family, friends, and also lots of other social groups where you can get this help, like meditation groups, spirituality groups. So this is my answer to it.
Ravi, you want to say
very
something?
Well said, yeah.
What Dr. Meena said is very true. The first thing starts with first acknowledging, accepting, and normalizing. I mean, when you normalize, then you believe that you are not alone. You understand that so many people are going through this along with you, which makes a lot of difference in the way that we react and respond to our situations.
Ravi, you want to say something?
Sure, thanks. Excellent talk, Vijay. Very extensive, and probably will need repeated watching to go through each individual aspect, like Kimu said. A couple of comments. One is, with respect to sleep, there's a lot of evolving data from like Yves Cortier and other people who very clearly demonstrate that there is a J-shaped curve with sleep and outcomes. Like for everything, every other biological thing, about 6 to 7 hours of sleep is appropriate. Too little is bad. Too much is bad as well. So there's a, like a Goldilocks moment for this as well. And then the other thing that is very interesting. I mean, this is something that I want you to sort of help people understand. So these watches, like the Apple Watch, etc., they give you, they look at sleep and they say deep sleep and light sleep. So deep sleep, is that the same as stage 3 sleep, or is it, is it multiple? How do they do that? That was going to be one question. And second is, how do you, what would your advice be to people who do a lot of international travel, going across time zones, jet lag, and, sleep deprivation because of jet lag? Because these days, everybody is expected to hit the ground running, whatever time zone you're in, right? So those would be my two questions for you.
Yeah, the devices, I think the deep sleep refers to the stage 3 sleep, because REM sleep comes differently. So REM is different. REM is also some people consider a deep sleep, but this one comes differently. So stage 3 would be deep sleep. That is, I think, what they refer to, all the devices, I think, or at least most devices. I think it's very accurate. And whenever I found very grogginess in the morning and etc., then I look back at my sleep score, very accurate, absolutely accurate, that my deep sleep has not been adequate for that day. And whenever I feel energized in the morning, I always look back. Now, these are not absolute values, but it helps one to compare yourself, whether you are doing the right thing or the wrong thing. Now, it may not be an absolute score to say, okay, I have great sleep, not like that, but are you on the right track or in the wrong track? For that, it's absolutely fantastic. So please don't ignore your. Regarding international flights and time zones, all various techniques that we told you to get sleep. So as long as you sleep well on a flight, the jet lag is minimized to the maximum possible. Yeah. So instead of taking any medicine to sleep, if you are able to do any of these techniques, whether the progressive relaxation technique that you have, or whatever technique that works for you, then if you're able to do it and get a good sleep on the flight, and then that reduces that's the biggest tool that you have against jet lag, and then that should minimize it or mitigate it to the maximum extent possible. So whenever I've had international flights, I slept well, I've been fine. But whenever I've not slept during international flight, it's been real horror stories. Yeah.
I'll tell you my fear of sleeping on a flight. I'm very afraid that I might end up losing a connection or something like that. So I typically stay awake during the flight or try to minimize my sleeping so that I'm fully awake. But one of the things that I've found recently that helps me sleep is this product called Relaxation, which is the only FDA-approved melatonin receptor agonist that's available on the market. It comes in only one strength, 8 milligrams, and it's been phenomenally useful for me. I used to try the over-the-counter melatonin and discovered that there was no batch-to-batch consistency. Forget about batch-to-batch. There was no tablet-to-tablet consistency in terms of how it would work. But with Relaxation, it's been a wonderful experience, and it has definitely improved my sleep. I mean, for jet lag, I don't use it.
Interventions are okay when you do it once in a way. So on a flight, international flight, you're probably going to do it once in 3-4 months. So that's perfectly okay. If somebody is depending on a pharmacological intervention for the daily sleep, that's a bad idea. However,
No,
I'm just telling you, just for the audience. Yeah. So that's perfectly okay.
No, absolutely.
Anything that's done once in a way has got no consequence, health consequence. But when something's done on a daily basis, that's what you mean by lifestyle, and that may have serious consequences.
Mr. Devote, can you?
Yes. Can you hear me? Yes. Thank you, Dr.
You can turn your camera on, Evil.
I've got a face pack on, ma'am. You really don't want to see my face. Right. Okay. Thank you so much,
Is it a
Dr.
sleeping
Bose.
device?
It means you're relaxing.
Thank you so much for the talk, Dr. Bose. I consistently felt like an outsider, feeling like I was this odd person out who had a holistic bent but wasn't a practicing allopath. So thank you so much for making it making it okay for me to talk about this to my patients. So I want to really appreciate you for this talk. And the second one I would like to probably suggest is, is it possible for us doctors to get together, maybe have a meditation room, a decompress room, or probably a group where people can get together and have like a support group for doctors? Because I constantly feel that we are taking the second place to our own professions. And for the first time, I feel completely comfortable saying I'm a practicing meditationer, I'm a practicing pranayama student, I do yoga every day. I just never, ever, ever said that to any of my patients. So I almost feel like this is my coming out day. So thank you so much for that. But I would love for doctors to get together. If that is possible, is that something that we could consider? That would be my question. Yes.
Yeah, I think it's certainly possible. And I said, I think we must reorient ourselves to, look at health intervention, because we never taught in medical school. And unless we get together in a group in our hospital, and then not only, if you have a sportsman, for example, have you ever found an international level sportsman who is poor in health? Or, have you found, a musician who is not good in music? But, as doctors, our health is very poor. That's a big paradox that I found always very interesting. And doctors have all kinds of medical problems. They have heart disease, they have liver disease, they have diabetes, they are obese, but we trade in health. That's a profession. It's such a paradox, really, isn't it? So I think we should all get together and we must change this allopathic view into a more holistic view. Then we must distinguish between health intervention and disease intervention. And, even health group, as you suggested, I think we should all get together and take this forward. I think that's the way forward, really. Pata, what are your thoughts?
Yeah, totally agree with that.
Professor Rajaram, would you like to say something else?
Vijay, prima facie is an excellent talk that you have given us, but only I feel sorry that it should go to the larger audience and special to the community. I just would like to give my own personal experience. Right from my primary school till the college day, till medical college, I was taking part in either NCC, Scouts, Cubs, where all these activities were enforced. And today, unfortunately, all these programs have disappeared, including NSS, which is supposed to have been introduced. So I think just now our previous speaker, Edel, has very nicely said that it should be reintroduced, or it should be introduced at least in medical fraternity. But is it possible from our side, Vidya can take up the issue with the education board again? Because now, since especially in India, Modi has changed all the ministers, we should recommend that, saying that a compulsory half an hour or 1 hour, these programs should be reintroduced, as yoga has been introduced in many schools in US and other ways. I think this is very important. Otherwise, our listening and all these things of no, not we may practice, we may give up our melatonin or whatever it is. But I am interested in percolating this message, percolating into the community, and that can start with the schools and colleges.
Absolutely, I agree with you, sir. Absolutely, we need to do that.
Dr. Vijay, you've already been talking at other forums as well, right?
Yes. It's sort of become my ikigai. And Dr. Vijay, your ikigai is conducting this marvelous medicine. I must say, you did a great job, and that's your ikigai.
Do I look so happy? And Radhakrishna, some thoughts from you.
No, as expected, Vijay has been brilliant, and actually, for me, or for the matter, most people, we are little aware of what is good diet, bad diet, what is good exercise, bad exercise. But these things of sleep and relaxation and mindfulness, we all know a little bit of everything, but we never understood that these all have a lot of scientific basis, and they have a huge impact on our day-to-day life. We never really chronicle our sleep patterns, nor we correlate anything of what's happening during the daytime with our sleep. I think every aspect. I think Vijay can come out many more such nuances, and everything seems to have some relevance. And as he rightly says, the doctors are the worst people when it comes to sleeping properly or eating on time, eating well. I think the movement should come from within, as Professor Rajaram is so agonized in the whole thing. And actually, it's true that, sir, this sort of marvelous medicine is one attempt to bring things to the public, and Vidya has been working hard, and people like Vijay Bose has a find for us in a very renowned orthopedic surgeon talking about an area which is so passionate about. And I think is to see that even in this talks, a lot of interest in what he speaks, actually. I think people are interested, people want to change. And I think, as Professor Rajaram says, this is the right time to bring this stuff into schools, colleges, and other social media. I think we should work towards that. Wonderful session, Bose. On second, but we don't want this to be the last one, but then we'll wait for the fourth one.
Thank you.
So, Professor Rajaram, we have YouTube links of these recordings and of these sessions, and we share them widely. And in fact, though Marvelous Medicine is perceived as a gathering of doctors and different rights, but for all these common topics, we invite. I send the links to lay public also, to friend, family, everything. And there are a lot of non-doctors logged in today. And many of them are following up with Dr. Vijay with questions and doubts. And also, we have made a small beginning, but I take what you said seriously. And I live in an apartment complex in a community, so there are a lot of young parents. So maybe I will, approach them and find out how to reach out to a larger audience, especially children and young people.
There's a question in the chat box saying, where do you get these recordings? There's a YouTube channel called Learning General Surgery. Learning General Surgery, YouTube channel. You go there, you get all the Marvelous Medicine recordings, including Vijay Bose's recordings, please. Learning General Surgery is the YouTube channel.
Dr. Rajaram, you were going to say something?
Kimu is there, Vidya, if he wants to come in and comment.
I couldn't find him.
Yeah, he's there. Yes, sir.
Yeah. So, Kimu, you're keeping yourself hidden. You have to give an update to Dr. Vijay Bose about what's been happening since May.
I have been giving an update to Dr. Bose. I am following all his part 1 and part 2. And for the first time in 20 years, I have reached less than 75 kilos. And I've been recording this less than 75 kilos in 3-4 weeks. Doing well. Thank you.
You have some more to do now. You've got lots of homework to go through the slides and then.
One part of this thing includes some pranayama, but he wants us to breathe that way throughout the 24 hours. I think I have to take a new leaf like that, but I hope some of it I can do well. One thing I have noticed is I have stopped waking up after doing exercises at 1 o'clock and fiddle around with my cell phone till 3:30 and then go back to sleep. So now I sleep until 5:30 comfortably. So there are lots of changes. I am very grateful to Dr. Bose.
Professor Rajaram, you are going to say something, sir? Could you unmute yourself, sir?
I thought we should start with our own families. For example, sleeping till 10 o'clock, 11 o'clock on weekends should be stopped in our families first. Especially on the children.
Well, if you have teenagers, it's very hard to implement, but it's definitely a good start.
I have a few pointers to make, ma'am. Can
Yes,
I ask,
please.
ask one question?
Please go ahead.
Yeah.
Can
Okay.
you put a
So,
camera on, sir?
yeah. Yes, sir. Yes, sir. So, basically, firstly, sir, the question I would like to ask you: do you think that time management and discipline forms a very major? It has a major role in decreasing our stress. So, do you think from the very childhood we should actually improvise on time management strategies? I think that is very essential. Would you want to say something, sir?
Yes, yes, I think very important. But sometimes you find people caught up in time management so much that itself stresses them out. They're so there's a balance to everything. But I think maybe not children, but as you enter your professional life, I think it's not as we say, it's not the one who wins, not the one who works the most, but one who works most effectively. So time management, I think, is very, very important, and I think we should learn. Like anything else, practice makes perfect. Time management is a skill, and once I think we should all practice that. Yeah.
Another thing, sir, I want to ask that there's a very common notion whenever there is stress, we have grown up listening, men don't cry, men don't express. So do you think you would want to break that myth and tell people that it's okay to cry, express, talk, listen, men, women, children, anybody alike? Like I have a 3.5-year-old son, and I hear people telling him that don't cry. So that is really sad.
Yeah, fully agree with you. Yeah, I think there's all societal notions we must break. Yeah, breathe fully, live fully. All that is very important.
And one last thing I would like to say, so here, because we're talking about stress, so there is this one 5-3-2 strategy, which I think I would just want to share with the people here. So basically, when we get up in the morning, we get up thinking about all the things we want to do the entire day. It's like so much is going on. Your mind is completely fogged. It's called as a mind fogging. So, instead of just starting to prioritize, usse saath, ki, okay, this is what I want to do, etc. I think first begin by thinking about 5 people you would like to thank for gratitude, which is very essential. So just begin by thanking those 5 people, which will take you less than a minute for whatever. Then the next is three. Three stands for 3 minutes. So in the whole day, you can just give about 3 minutes undivided attention, which has to be totally for people who are around you. It can be your parents, your children, your spouse, your people working for you, who you really want to kind of acknowledge in a lot of ways. So it has to be 3 minutes unmindful, uninterrupted mindfulness, recognition for their efforts. And then two stands for 2 seconds. So there's a research which says that when we see people, we make assumptions in less than 30 milliseconds actually. Like this person is this way or that way. So they say only for 2 seconds, if you cannot make those assumptions, then just say thank you, may God bless you, may the power be with you. So this 5-3-2, this I have been practicing for a few days now, and I feel that it immediately shifts the focus, and it engages you to the more positive part of your hemisphere. I think. Yeah, thank you.
Thanks very much for that.
I have just pasted the link on the chat box for the playlist of all the episodes of Marvelous Medicine. So while the session will be on for another minute or two, so if you wish, you could copy that. Otherwise, just remember YouTube channel Learning General Surgery, and you can go there and search for the Dr. Vijay Bose's talk. If any of you have mine or Radhakrishna's phone, feel free to send a message and I will send you the link as well. Thank you once again, Dr. Bose, for that excellent lecture, and the amount of time and effort you take to get all your slides ready and have every single detail explained to absolute dummies. I really appreciate that. And you are helping us bridge the gap between doctors and non-doctors, because your talk applies to everybody. And thank you, Dr. Rajaram, for joining us from the US, and being so passionate about how we should take this message forward. So I never thought of it till now, but now I will sort of give it more thought. And thank you, Meenan and Ramya, for sparing your time during dinner time with kids and all. Thank you so much for joining and for all your inputs. And for all those who are logged in, we will be meeting Professor Rajaram again next week, where he will be moderating a session by his own students. So I'm sure we'll have a very enjoyable session. Thank you, everyone. Take care and stay safe. We'll meet you again next Thursday at 8 p.m. for another episode of Marvelous Medicine.
Thank you so
Bye.
much.
Thank you, everyone.
Thank you.
Thank you.
Thank you. Thank you, everyone.
Good night.
Good night.